I'm Dimitri, and this portion of the presentation will look at drink driving from the perspective of forensic psychology. Forensic psychology is a branch of psychological practice that is concerned with issues that connect psychology and law. While it has been given many broad definitions over the years, it has been stated that forensic psychology refers to clinical psychology applied in a setting within the legal system. Forensic psychologists can be found working in a range of settings, including prisons, jails, rehabilitation centres, police departments, and law firms, just to name a few. They may work directly with attorneys, defendants, victims, or with patients within the state's correction or rehabilitation centres. Generally, psychologists working in corrections may attend to the mental health care needs of inmates, including psychological assessment, individual and group therapy, anger or crisis management, or court-ordered evaluations. They may also consult with prison staff, inmate attorneys, advocates, and court systems on a variety of mental health related topics or recommendations garnered as a result of psychological assessment. Forensic psychologists may have to provide an assessment of an individual's competency to stand trial or provide expert testimony in a legal proceeding. They may also be asked to conduct a risk of recidivism assessment to gauge the risk of reoffending and provide a report of the defendant in order to inform the judge's decision on sentencing. Drink driving is one of the most important causes of traffic accidents. More than 50% of worldwide traffic-related deaths, particularly among young adults, are the result of drunk driving. In 2016 alone, there was a total of 1,295 deaths on Australian roads. Furthermore, 22% of all Australian road deaths involve the use of alcohol. Studies have shown that up to 15% of drink drivers reoffend within 5 years of their previous offence. Further to this, recidivists have been found to have a higher involvement in alcohol-related road deaths and other traffic offences. As such, it is increasingly important to target drink drivers, particularly their risk of recidivism, so that proper intervention techniques can be implemented in the hope of reducing drink driver reoffending and in turn reducing the amount of road deaths attributable to alcohol. Impulsivity and aggression have been implicated as fundamental in a wide variety of problem behaviours. Further to this, impulsivity has been strongly implicated in both aggressive behaviour and offending in general. Drunk drivers usually exhibit impulsive behaviours, indicating that they have problems in personality traits. It has been found that individuals who have high impulsivity scores have higher alcohol consumption and drunk driving attitudes, and that there is a relation between lack of planning, decision making, and sensation seeking with drunk driving. In addition to this, impulsive people are more impatient, have poor planning skills in regards to drinking domains, and are more likely to engage in irrational decision-making processes, such as hyperbolic discounting. In addition to these personality factors, Brown suggests that peer normative processes are also associated with drink driving. Research has shown that people who drink drive overestimate the amount of drink driving behaviours in their friends and are also less likely to perceive that their friends disapprove of drink driving. This suggests that explicit peer disapproval of drink driving may have a discouraging effect on drink driving or recidivism behaviours. DUI recidivism is related to a range of personal factors. It has been found that repeat offenders experience more interpersonal and intrapersonal problems, are more deviant prone, have greater levels of substance abuse severity, and are more likely to be unemployed. DUI recidivists are responsible for a substantial proportion of traffic offences, and some studies have reported that nearly 33% of known offenders will be re-registered. Similarly, Headland 1995 reported that 20 to 28% of first-time DUI offenders will recidivate. These results indicate that DUI recidivism is a stable problem in a society and an issue that has to be addressed. Although high-risk drivers account for only 6% of driver population, they have a substantial impact on overall traffic safety. As such, the ability to identify high-risk drivers will provide a valuable reference for developing safety regulations and education programs. Risk assessment is a procedure used to estimate the quality and probability of the occurrence of various possible outcomes. As such, a risk assessment is a daily part of practice in most psychological settings. There are three main approaches to conducting a risk assessment. These are the unstructured clinical approach, the actuarial approach, and the structured professional judgment. Of the three approaches, the actuarial approach has been shown to have the most validity and reliability. The actuarial approach determines what risk category a person is in based on the presence of static and dynamic risk factors that have an empirically established relationship with the behavior in question. Static factors are characteristics of a person that cannot be changed and are predictive of reoffending. Such characteristics include age, gender, intellectual functioning, and poor upbringing. Dynamic factors, in turn, are characteristics of a person that can be changed. Such characteristics include association with deviant peers, personal distress, anxiety, low social achievement, and substance abuse. The more of these risk factors that apply to an individual, the more likely he or she is to reoffend. The purpose of conducting these risk assessments is not only to ascertain whether a person is likely to reoffend, but also to present courts with a report that may influence the judge's decision whether the offender is granted parole or a prison sentence. There are a range of programs that have been developed in the aim of reducing DUI recidivism. These include the Ignition Interlock System, DUI education, and victim impact panels, just to name a few. However, most of these programs have been found to be largely ineffective in reducing recidivism, or are effective during participation in the program, but cease to be effective once the program has been completed. For example, in a study looking at the effectiveness of interlock systems in reducing recidivism, found that when the interlock system was installed in the vehicle, the interlock group had a 60% lower recidivism rate than the control group. However, once the interlock device was removed, this difference in recidivism was no longer significant. However, evidence exists to suggest that multi-component programs are more effective than those which target only one aspect of the issue. For example, evaluations of the intensive supervision program, which consists of DUI education, substance use treatment, and a range of monitoring techniques, have consistently reported significant reduction in DUI recidivism. This may be because the multi-component programs offer several ways of changing behavior within the same program. This allows those who are unresponsive to one component to benefit from others. In summary, drink driving recidivism is a major contributor to annual road deaths. It has been shown that impulsivity is strongly related to drink driving and reoffending, and a whole host of dynamic and static risk factors are associated with reoffending. As such, multifactorial models of intervention have the most effectiveness in reducing recidivism. Now we will hear from Sonia, who will present a neuropsychological perspective on the topic.